So if you haven't heard, RFK and Trump's administration are trying to take away access to SSRIs, which are some of the most commonly used psychiatric medications in the world. SSRI stands for Selective Serotonin Reuptake Inhibitor, and lots of studies show that they can be effective in treating depression, anxiety, and lots of other conditions. RFK is saying that these medications are addictive and don't actually treat anxiety or depression, and that anxiety, depression, and other mental illnesses are being overdiagnosed. His solution is to send everyone who is on SSRIs to mandatory wellness camps, aka detention centers, for 2 to 3 years. As someone who is on an SSRI in addition to other psych meds, I'm terrified. But also, I'm fucking pissed. And not just with RFK and Trump. I am furious with every therapist, psychiatrist, and mental health professional who has ever suggested that neurodivergence is being overdiagnosed right now. And I'm especially pissed at that study that came out in 2022 saying that there was no link between serotonin and depression and that we should be very concerned about the overuse of antidepressants. That study was poorly conducted, poorly written, and poorly disseminated, but you know RFK is going to use it to justify these horrific actions. Look, I know depression is not purely chemical, okay? We've been knowing that since the 70s. So all these gotcha articles about how antidepressants aren't the only answer, like, we know. So many studies show that antidepressants are 1,000,000 times more effective. I'm exaggerating, not literally 1,000,000, but way more effective with therapy. But you know what's even more effective than antidepressants and therapy? A society that doesn't see you as a threat or a burden. If you take SSRIs, I'm not telling you to panic, because we know that this administration can sometimes be very ineffective and sometimes talks a lot bigger than they act. But we are also seeing that they're being a lot more aggressive this time around, and we do need to take this threat very seriously. Personally, I recommend talking to your psychiatrist, talking to your family doc, and trying to get a hold of as much of your medication as you can. And be careful who you talk to about taking SSRIs. I'm a little fucked because I talk about this stuff on the internet very publicly, and my job is to reduce stigma so this kind of shit doesn't happen. But if you're not I hate to call myself a public figure, but if you're not public about your SSRI usage, now is not the time to become public about it. And if others have entrusted you with the information that they're also on an SSRI, no, they're not. You heard nothing about it. You don't know shit. We will not comply. We will not send our neighbors to these wellness camps. We will not be part of this. So don't panic, but be fucking prepared.